Hi, my name is Sarah Schettle. I'm grateful for this opportunity from the Society of Thoracic Surgeons to talk to you all today on some opportunities for professional development and academic promotion for advanced practice providers. I'd also like to thank the workforce on multidisciplinary care for giving me the opportunity to share about this important topic. We will go over 6 different topics during this talk. The first is academic promotion, and really the subsequent items, as you can see on this slide, all do relate to academic promotion, and we will spend some time talking about each of these. They include quality appointments or certification, grant funding, publications and presentation related recognition, opportunities for preceptor awards or recognition, and finally, we'll conclude with society-specific involvement or recognition. So let's begin with academic promotion. Academic promotion is something that is an opportunity for many advanced practice providers. This includes nurse practitioners, physician assistants, perfusionists, and a variety of other advanced practice providers. In order to achieve academic promotion, demonstration of scholarly activities is typically required. In this context, several of the items listed on this slide will help to gain academic promotion. In particular, things like academic promotion include rankings of instructor, assistant professor, associate professor, and those types of things, and they depend on one's professional engagement and involvement. These can be demonstrated through quality appointments or certification, and those particular certifications or appointments can either be through one's individual hospital or through an external approved quality academy. Other opportunities include clinical research, and we will spend time talking about this. It's important to note that research can include both funded and non-funded opportunities, and those funding opportunities may come from within one's own institution or externally. Additionally, publications and presentations, including things like invited lectures, are included amongst these scholarly activities, and we will talk about opportunities for that. There's also opportunities for mentoring and teaching. As all of us have been mentored or taught by someone, we have the opportunity to give back to the next generation of healthcare learners. This can be mentoring other APPs, nurses, residents or fellows, depending on your institution, or other non-clinic employees or patients and families in the clinic environment. And finally, professional society membership, and in particular, involvement within that society, helps demonstrate scholarly activity. Leadership roles and committee participation are a few of these opportunities, and we will talk about these in a bit more depth. Let's begin with quality appointments or certification. Quality is an important aspect of most hospital environments, and any work that APPs do towards pursuit of quality is often included within that combination of information that demonstrates worth or merit towards academic promotion. Quality improvement skill development can comprise any one of a number of opportunities, and you can see these listed below. And this is not an all-encompassing list. There are several items beyond those that are just listed here that could be considered. Individual quality programs could be developed by a hospital, and those might be of interest to a nurse practitioner, a PA, or other APP. In addition, there's a National Association for Healthcare Quality, and this slide deck will actually be posted on the STS website, so you may feel free to visit this and click on these links at your leisure. There are Joint Commission resources that demonstrate opportunities for quality management and patient safety training and education. There are several online course offerings and opportunities and advanced educational opportunities. For example, going back to school and obtaining a Master of Science in Healthcare Quality or Safety. Once certified, opportunities for analysis of quality concepts might be considered by the advanced practice provider. These not only will help your institution, but patients as well in improving their experience within the healthcare environment. By identification of healthcare quality metrics, data, and identifying waste, you can improve the healthcare system. These also can result in cost savings opportunities and improvement in patient care, which is why we are all here ultimately at the end of the day. Some PAs have more of an interest in bench-side research or patient-focused research in lieu of quality or in addition to quality. And the grant funding that may be desired in such a context can, in some cases, be tied to protected time for the APP. If one is looking for grant funding, there are a lot of opportunities from different organizations and societies that offer these sorts of fundings for APPs. Below, I have included opportunities from both the American Heart Association as well as STS, And I presume because you are watching this, you have interest in STS. So feel free to visit that link after the completion of this talk, and you might learn more about some grants or awards that might be of interest to you. There are also awards that are specifically geared towards advanced practice providers. So I have included 2 links below for those for nurse practitioners as well as for PAs for some research grants. In addition, if you belong to a subspecialty within medicine, and in this case, potentially thoracic surgery or a surgery specific specialty, or even a different medical specialty, there are different societies and organizations that offer grants specific to these subpopulations. I've included 2 of these, one for the International Society for Heart and Lung Transplant, and another which is for at least an area that I work in, which is for patients that are supported with ventricular assist devices. And they also offer a research grant. Often grants will require submission of applications as well as presentations, updates on the results that were obtained through the funding, and possibly presentations following completion of the work. If one is interested in pursuing publications and presentations that may result from some of the research that was done, often meetings are targeted to present these results at. These meetings may be APP specific meetings, or they could be a larger national meeting that targets providers that span nurses to APPs to physicians and surgeons. In addition, if one is interested in publication, identification of an appropriate journal is also important. There are certainly APP-specific journals, as well as broader medical-specific journals or general medical-specific journals. And identification of a journal that meets the demographic that you are interested in targeting with your publication is important. Opportunities for mentoring and teaching also abound for advanced practice providers. As I mentioned, all of us required individuals to help us on our way, and it is a wonderful thing to be able to give back in this area. Many programs or schools offer opportunities for mentoring, preceptorship, or teaching, and have awards associated with these particular endeavors. Things like mentoring and teaching may involve other APPs, but they could also include things like medical students, shadowing, or even involvement of patients and families if one is teaching in the hospital environment in their role. In addition, there are opportunities for different conference participations to share educational and teaching opportunities and things learned from those particular engagements. Finally, professional society involvement and recognition is a wonderful opportunity for APPs to become engaged. Membership in professional societies offers opportunities to not only network and collaborate with other individuals that have similar interests in patient populations, but also affords opportunities for participation in the role of involvement as a speaker, a moderator, or potentially a panel member. In addition, there's opportunities for involvement in workforces, task forces, steering committees, advisory panels, and a whole host of other areas. There are many leadership positions that are also available if one is so inclined to proceed in that direction. In addition, there are certainly representative societies for APPs. There are specific nurse practitioner societies, PA societies, associate membership within the STS, and other cardiac related specialties that might be of interest to you. So with that, I'd like to thank you for your time. Hopefully you've learned a bit more about professional advancement and opportunities for involvement and engagement with APPs. And if you have any questions, feel free to email me, and my email address listed below. Thank you so much.